filling requires three materials. The first one is the etchant, then bonding agent, and the composite. Hello everyone. Today we are going to see about the various basic materials required in a dental clinic. So we'll start with restorative materials. So this is glass ionomer cement, which is used for restoring the cavities, which is known as cataract molar, which has got very good mechanical properties, and it is commonly used for posterior teeth restoration as a bulk filling restoration. Its compressive strength is around 270 megapascal, which is very near to the conventional amalgam. Next we have another type of glass ionomer cement, that is restore glass. It has got various shades. We can select the shade depending upon the tooth which we are going to restore. It is basically used in non-stress bearing areas such as the cervical areas, basically for the cervical abrasion cases. The next product we have a similar glass ionomer cement, which is the brand name is Miron, which is a luting cement, which is basically used to fix the crowns, that is caps, posts, various orthodontic bracket. Or G, which is a temporary restorative material ready to use type with zinc oxide and zinc sulfate 1, used until it gets a permanent filling. Next we have the dical, which is calcium hydroxide, which is used in deep pulpal cavities where it is almost exposed. It has got sedation effect and thermal insulation effect, which comes as a base and catalyst. We mix both these and apply it on the deeper pulpal cavities, so it has got healing effect on the pulp. So it is always as combined with this G, that is a temporary filling. We apply dical at the over the pulp and then temporary filling. This is zinc oxide powder and the eugenol liquid. Okay, so in case we don't have the ready to use material, that is this G, instead of this G, we can use this zinc oxide zinc oxide powder and liquid, and it can be also used as root canal sealant material. So this will be mixed with gatapacha cones and will be sealed to the root canal. This is a gel which is a etchant. Okay, it consists of acid intend to create microporosities on the enamel surface, which will be applied on the surface of enamel. It causes demineralization and removes enamel and creates microporosities and increases the surface energy. It is the first step of composite restoration, because composite has to come and bind to the tooth surface, but it is done with the help of bonding agent. Once the etchant is applied and microporosity is created, we clean it off, we make the surface very dry, then we apply the bonding agent. This bonding agent helps to bond the composite material to the tooth. So this is a composite material which will be bonded to the tooth with the help of bonding agent. So depending upon patient's tooth shade, we can select the shade. So a composite filling requires three materials. The first one is the etchant, then bonding agent, and the composite filling material. This is ionoseal. Ionoseal is nothing but a light curing ready for use glass ionomer composite cement, and it can be used for various restorations and fissure sealants. So ionoseal is basically used as a fissure sealant. Next we have Endoprep RC, which is basically a EDTA containing root canal irrigant, that is EDTA and carbamide peroxide, which is a root canal irrigant and conditioner. Similarly, another brand also we have. EDTA is nothing but to facilitate a calcified canal, which is a chelating agent. Next we have Seal Apex. It also comes like base and catalyst tube tube system, which is a eugenol free calcium hydroxide root canal sealant, which is used in sealing of root canals, which promotes rapid healing and also formation of hard tissues. And this is topical anesthesia, that is in the form of gel. This is a benzocaine gel which can be applied over the mucosal surfaces for the procedures, various surgical procedures, or also to remove the milk teeth, that is kids teeth, which is a benzocaine gel. Whereas adult teeth or better anesthesia can be obtained by this lignocaine solution. This is applied through the injection. This is lignocaine adrenaline injection. Lignocaine and also adrenaline is there. Adrenaline will not be there. Plain lignocaine will be given for patients with cardiac diseases, because this adrenaline is a vasoconstrictor which is contraindicated in cardiac patients. And next we go to basic stones, that is which is type 4 dye stone. We use this powder to create cast, various diagnostic cast for denture and fixed partial denture fabrication, and also for orthodontic purposes. Similarly, we have, this is gold stone, that is gypsum plaster type 3, which has got lesser properties compared to the previous one. We have all the details mentioned over the pouch. This is green in color, and its strength is a little lesser than the previous one. You can see all the working time, setting time. So we mix powder and water to the desired consistency and pour to the mold. And then we have cold cure acrylic powder and liquid. This is denture fabrication material. We have basically heat cure, which is done under the heat processing. This is cold cure. We can easily prepare dentures or repair of denture using powder and liquid. Next we have orange wash gel, which is again a 2-component system which can be mixed to use as a impression material, that is secondary impression material used in the fabrication of complete denture. These 2 tubes we should take equal length of material in a glass slab, and just like the picture, we need to mix it thoroughly, then load into the impression tray, then take the impression of our maxilla and mandible. It's a part of denture fabrication. This is silicone based impression material used for creating very finer details of hard and soft tissues. So we can use this as a base and catalyst system. We can sorry, it's almost empty. So this base and catalyst will be mixed to a uniform consistency and loaded to the trays to create the impression of hard tissues and soft tissues. It gives very minute and finer details compared to the normal alginate impression and other types of impression. So this is very commonly used nowadays. This is tropic alginate, a better quality which takes impression of our teeth. Similarly, we have the normal alginate, that is very commonly used to take the impression of teeth to create removable partial denture, fixed partial denture. So both this normal alginate and the tropic alginate used for impression. So tropic algin is always a better option than the conventional alginate. So these are basic essential requirements of a dental clinic. It consists of restorative materials, impression material, and anesthetic solutions, various cast pouring materials, and various etchant, bonding agent, and all these materials are basic requirements of a dental clinic. Thank you.